Cryptosporidium is a protozoan parasite. Protozoan means it is composed of one cell. Cryptosporidium is found worldwide and is spread via the fecal-oral route. It is more common in children, peaks in the summer, but it is also a problem for immunocompromised patients who are at increased risk of developing Cryptosporidium infection. And Cryptosporidium may be spread through contaminated water, animal contact, for example, at a petting farm, and person-to-person contact, for example, when changing nappies. It is Cryptosporidium hominis that is associated with municipal water supply and swimming pool-based infection, whereas Cryptosporidium parvum is the one that is responsible for infection from farms and contaminated rural water sources. Cryptosporidium is a problem because it is highly infectious and it can survive in the soil and water for months because it is protected by a coat called an oocyst that also makes it resistant to chlorine and alcohol, and that is why it is such a problem if it gets into the mains water. Symptoms of Cryptosporidium appear 2 to 10 days after infection with watery diarrhea, nausea, vomiting and a low-grade fever that can result in dehydration, loss of appetite and weight loss. And if you get a Cryptosporidium infection just as you think it is all over, it can relapse. In immunocompromised patients, for example patients with AIDS, it can cause acalculous cholecystitis, that is, inflammation of the gallbladder without gallstones. Cryptosporidium infection is usually self-limiting, so the only treatment that is required is hydration, but it is also necessary to prevent Cryptosporidium infection with good hygiene. Pathologically, Cryptosporidium can affect any segment of the gastrointestinal tract, although it most frequently affects the terminal ileum and proximal colon. And when it affects the ileum, it can result in villus atrophy. That's where the villi, the finger-like projections, get blunted, and crypt hyperplasia, where the crypts become enlarged, and there is associated inflammation and crypt abscesses. The organisms themselves are seen as blue dots or basophilic spherical bodies about 5 microns across on the surface of the enterocytes. So red blood cells are 7 microns across, so these are slightly smaller than the diameter of a red blood cell. The presence of Cryptosporidium can be diagnosed in stool samples and confirmed using immunological techniques. This is a colon biopsy from a patient with Cryptosporidium infection, and right on the top of the surface cells you can see little blue dots, and these are the Cryptosporidium oocysts. And here is another view where you can see the Cryptosporidium sitting on top of the surface of the colonic biopsy. And this is a small bowel biopsy showing Cryptosporidium infection with the blue dots of the Cryptosporidium on the surface. And on high power, the Cryptosporidium can clearly be seen as small blue dots on the surface of the enterocytes. So Cryptosporidium is a diagnosis that can be very easily missed, but should always be borne in mind as a possibility with the relevant history. And finally, here is a high-power view of the pink-stained oocysts of Cryptosporidium in a stool sample.